she was in a chair, she couldn't get up and walk very easily. I think you once gave her an injection just right in her foot just to get her out of her pain for a little while. But you said, I can't keep doing it this way. It's not going to work. It's temporary.
Yeah.
Oh, yeah.
No.
So the only thing is, are you going to want me to refer to any of this or not?
Sure, sure.
So, but
Let's
where
go
am I going to
stand.
have to?
Let's go over here.
Okay, well, because I don't want to really hold this.
No, you just have to remember it. Don't worry.
Oh,
it'll
I
help
won't
you.
remember it.
Oh,
Not
it'll
all
help
the
you.
specific
you don't need to.
procedures.
You don't
Okay.
need to.
Okay.
You're standing.
I am.
When you came to me, how long ago was that?
About 2 years ago.
Were you standing then?
No, I was not.
How did you arrive?
Either with a walker, a wheelchair, or a cane.
I remember the first time that we were able to take the pain away in your foot. And the only way that we had succeeded at that was by giving you a spinal block and completely numbing, paralyzing your lower extremity.
Right.
And you said something to me that I still remember today. I don't know if you remember saying this, but you said, I feel the same joy I feel right now is the same joy I had when I put my son on my chest after he was born.
Yes, I do remember that.
And that was, as I recall, the first time you had relief from pain in about 2.5, 3 years.
Yes, because my original surgery was February of 2012. That started this
And what
trip
happened?
down pain lane.
What happened with that surgery? I mean, what was the result ultimately? What did it lead
Major
to?
nerve damage in my heel, my right heel.
And that's why you couldn't stand.
That is correct. For the first couple of years after that surgery, I was bedridden for the most part.
So, no seeing friends, no playing mahjong, no shopping.
No, no. I actually had reached a point of depression where I didn't want to do any of what you just mentioned. Put on a lot of weight.
Yeah.
Prior to my surgery, I was a lot thinner, a lot what I would call healthier.
Well,
I
you're
ran.
running.
I ran about 7 miles, I would say, a day, in addition to doing aerobics and swimming and
You're an
whatnot.
active, engaged.
I was very,
woman.
very active. One of those shop till you drop girls. My mall days were over for a while.
So what happened to this part of you when you couldn't do normal life?
It was devastating. I can't, I mean, if you asked me to use one word, it was absolutely devastating, debilitating. It was very, very difficult to adjust to that, because from going to an extremely active lifestyle to a sedentary lifestyle, sedentary to the point where I came down with orthostatic hypotension and ended up in a hospital in intensive care. So it was very, very difficult.
I remember when you came to me the first time and you were in a wheelchair and you were wheeled in by your knight in shining armor, and you really couldn't tell me what had happened because you were having an attack and you were
That's right.
crying. But not just crying, you were weeping. Your soul was weeping. And I remember thinking to myself, is this real? Can someone, and this is all I do all day long is see people in pain. And I thought to myself, how can she, I mean, is this, and I remember asking Mr. K, I said, what's going on? Is she like this all the time? And he said, yeah, pretty much. Sometimes not, but often. Most of the time, this is what it's like. And you couldn't have a conversation with me. It would be like trying to talk to someone who's being attacked by an alligator, or someone who had a tiger chewing on their leg or their foot.
Great analogy.
And expecting to have a conversation with that person would be ludicrous. Now, of course, there's no tiger to look at, because people in chronic pain, the pain's on the inside. There's no external manifestation, and so you're passed along, and from doctor to doctor and institution to institution.
40 to be exact.
40.
I have actually kept track of the medical providers that I have seen since February 2012. and that would include hospitals as far south as the University of Miami-Jackson and as far north as Dartmouth. I went to the University of Michigan, and I mean, we're talking well-respected neurologists, neurosurgeons.
Go to the Mayo Clinic?
No,
No.
I did not go to the Mayo Clinic.
What about Cleveland Clinic?
I did.
Yeah.
I did go to the Cleveland Clinic, had a series of ketamine treatments out there. I have basically covered the gamut of whatever you pain management doctors have out there in your little box of
Tricks.
tricks, exactly. You know, I've tried physical therapy, nerve blocks, like I mentioned, the ketamine, a
Host of
myriad of
medicines.
drugs, pain meds that I couldn't even begin. The list would be as long as probably Santa's list. I've had injections in my spine. A doctor up in Boca did them under anesthesia.
Mm-hmm.
Lumbar blocks, nerve blocks, like I said.
Ankle injections, foot
Ankle,
injections.
and more than I care to remember, because those are,
Yeah,
that's the
not
kind of
fun.
pain that you definitely remember. But pain also becomes very relative. The kind of attacks that I was experiencing, it was almost like The Exorcist. That's the only analogy that I can think of, where you just are in so much pain, you become deranged almost. I remember having conversations with Richard and you. You know, you reach a point where just take it off, just amputate it, because you're so desperate to want to get rid of that kind of severe and acute pain.
Yeah.
I mean, I remember going and grabbing a bottle of pills. Pain, I've come to the conclusion that it changes who you are.
Yeah.
You're not your normal self. The pain is so overwhelming, and you're not thinking rationally, and you do things that you would never ever imagine yourself doing. So fortunately, I'm here standing and giving you this little update here.
So how are you standing?
I'm standing because of the DRG that I just had implanted almost, I guess, about 3 weeks ago. No doubt. Prior to the DRG, I would absolutely be sitting in that chair right now, and hoping and praying that I wasn't going to have an attack while I was here. I've definitely seen major improvement. Thank you.
My pleasure.
And it's given me my life back. A good part of my life is back.
Now you also have a pump. We implanted Marcaine,
Yes.
bupivacaine pump.
Yes.
You still use that?
On occasion, yes. Which is a tremendous, you know, it's kind of like the backup quarterback.
Yes.
You know, it comes in
Yeah.
when the starting quarterback goes out.
Are
So
you taking
I am-
narcotics?
No, I have not taken any type of pain meds in, I would say, since you implanted the pain pump.
Yes. Which has no narcotic in it, actually.
That is correct.
Yes.
Marcaine, it's
Yes.
wonderful. I always refer to my device as Floyd, as in Pink Floyd, Comfortably Numb, for any baby boomers out there that know that song.
Yeah, that's a good one.
But between the two, I am able to function so much better and do more things, be more active than I was before. The problem with just using the pain pump that I had talked to you about, and why, you know,
Yeah.
we decided on the DRG, was with the pain pump, it numbs me,
Yes.
and therefore I cannot be active.
Yes.
It also creates incontinence.
Yes.
And at 61, you know.
Try and avoid those situations.
Yes, I do, the best I can. So,
The less you
I
have to use the
feel-
pump, the better.
absolutely,
Yeah.
that's the key. And I think it has controlled my pain so much better than before. The DRG is, you know how long I've been waiting for, because I know you and I had a
Yes.
conversation when it was still in the research process
That's right.
and trials and
Yes.
whatnot. And truthfully, that's what I was basing all my hope on, because I was kind of, I think I had pretty much run out of options.
Yeah.
Because I had tried, I mean, I remember going to an acupuncturist. I mean, you just try anything.
Yes.
But the one thing I just have to tell you, Dr. McRoberts, that I really feel is important is that you gave me the sense to never lose hope. And that was huge. Because everyone else that I had gone to, from the University of Miami to Michigan, they basically had not given me a sense of any alternatives, any sense of hope. And that's really what you just staying with me and thinking about the DRG. When I remember when it got FDA approved, and I immediately went online because I just wanted to verify, I wanted to see it in writing.
Yeah.
And I actually printed it out. And I remember to I kept looking at it every couple of weeks just to go, okay, Lynn, this is your light at the end of the tunnel. It's gonna be a rainbow. And that's exactly what it turned out to be. Thank you.
Oh, there's no greater pleasure than being able to do that for someone. So thank you.
The whole thing is, I don't want anyone to ever give up hope, because there is something out there.
And you can't find it on the couch.
No, you definitely cannot
You
find
gotta
it
go-
on the couch, under the couch, or.
You gotta go out
You
and
gotta-
advocate for yourself.
Yes,
And
absolutely.
keep hunting, and
Yeah.
keep looking, and
Yes.
searching.
Yeah, no, absolutely, and that's what I recommend everyone to do. I have, I run my Lauderhill Mahjong Club,
Yes.
and I have women, as a matter of fact, I think one of two of my women have since come to see you. And because they actually see how far I've come. So I have passed the word around that
Thank you.
you don't have to suffer. You don't have to, wake up in the morning if your knee's hurting, your hip, your back, your foot, whatever it is. There are treatments, there are procedures out there, the new medical technology.
Yes.
Fortunately, we live in a country that offers such wonderful, options.
Absolutely.
And so trust me, I am one of your biggest advocates,
thank
and
you.
I'm sharing the word so other people can get help.
You know what's not unique to your story, which is people who have serious chronic pain, who've been living with it for years, and in the DRG study, the average time to implant was something around 13 years, as I recall, which is amazing that people have been persistent for that long before they ultimately get an answer. But in almost every circumstance, as someone who ends up much better, maybe not 100%, but life back better, it's that they were their own advocate and they didn't stop looking. And that is, I think it's a major component of any story, which is, if you're told no, don't sit down
That's
and accept
exactly
it.
right. That's exactly right. You have to be proactive. Don't take no for an answer. I am a perfect example of that.
Yes.
If the first time I went down to the University of Miami and met with the head of anesthesiology, the head of their neurology, neurosurgeon, blah, blah, blah,
Mhm.
if I had listened to them, I would never be standing here right now talking to you. I would, don't even want to go there.
Can we look at the foot? Grab this
You can
rascal.
even touch the foot.
That's amazing.
Because do you remember when I first came in?
I do.
You could not even touch it.
Now, that foot, I
This
remember
is-
this foot because I remember wheeling you back into the OR
Mhm.
when we put the pump in, and you had already been sedated. and you had anesthesia on,
Right.
and we were positioning you,
Mm-hmm.
and you came out of the chemically induced sleep to plead, please don't touch my foot. You don't remember that because you were asleep.
Mhm.
But it was so painful that pain message made its way all the way through to the brain with even all that anesthesia on it, which is one of those things that I knew that this is serious, serious, serious pain. And not that we don't think that with everybody, but for you to basically come out of anesthesia to plead, please don't touch my foot, was shocking to me. And, it's something that plagued you, I know, while you were awake, while you were asleep, all the time.
Oh, yeah. I mean, I would wake up in pain. I would have such serious pain attacks that I was just begging for relief. I
How
would
many
pray
times
to
have you
God
gone to the
that-
emergency room, would you guess, with this pain?
Oh, that's a really good question. I have kept track of everything. A couple times just to get a shot of like dilaudid.
Yeah.
Because the pain was so overwhelming,
Yeah.
I couldn't take it.
Yes.
My husband, it was, I don't know, several times.
Think of all the expenditure that
Boy.
was, and just think of the expenditure moving forward from this point, and the expenditure up until this point. Dramatic difference?
Absolutely.
I mean, if you were an insurance company, wouldn't you say, gosh, we're going to make our money back in spades.
Without
If we
a
can
doubt.
just keep people out of going back to the hospital, searching.
Absolutely. I would think with, for those people that are taking pain meds.
Yes.
I mean, just not having to take pain medication anymore.
It's $4,000
is
per
huge.
year for 20 milligrams of OxyContin twice a day. That's incredible.
Yeah. Or even just, going for cortisone shots, going for nerve blocks, that is not a one-time deal.
Yeah.
That is something that, and I remember going, at least once a week when I had the ketamine treatments out at Cleveland Clinic. It was like 5 straight days in a row. So, yeah, this is much more cost effective, without a doubt. If the
Yeah.
insurance companies don't realize that yet.
And how much
They're
did you have to fight
mistaken.
with the insurance company?
Wow, that is a whole other story. You're very familiar because I
Yes.
know you had to get involved. Our insurance is with Humana, and we had to pretty much fight tooth and nail. Fortunately, I was able to get help with our local insurance broker.
Mm-hmm.
Because I think is new
Yeah.
at this point, but I certainly see and certainly hope that insurance companies recognize the extreme benefits of having this done and patients will not have to go through the appeals like I
Yeah.
needed to do. So I'm hoping as time moves on, and especially with there's got to be a tremendous success rate with this DRG.
There is, actually.
So, I certainly hope that they don't make it difficult on patients, because when you are in severe pain, the idea and the emotions that you have to go through with the insurance company is the last thing that you want to do,
Yeah.
because you're in a desperate state, and I was extremely hopeful with the DRG.
Yeah.
And as it turns out, it's just been.
If you could boil the experience of the DRG stimulator down to just single words, what words would you use?
Pain relief, that's number one.
Yeah.
I mean, getting my life back, being more active, less intrusive, in other words, less side effects.
Mm-hmm.
Of course, we talked about with the pain pump.
Yeah.
And the side effects that I have from that. With the DRG, I feel nothing, but yet get pain relief.
Pretty
It's
amazing.
like, it's my miracle. I mean, that's really probably the number one word that I would use after what I've been through for 4.5 years.
Any last words to tell people that are out there on the couch?
Like I said before, don't give up hope. That there is definitely relief out there, and definitely use me as an example, because for 4.5 years I suffered tremendously, and I cannot begin to tell you, Dr. McRoberts, how fortunate I am that I got to you, because without you I wouldn't have gotten to the DRG. So, but to people that are watching this, don't give up hope. Pursue whatever avenues you need to, and ultimately you will find the answer. And my answer happened to be the DRG.
Right on. Thank you.
Thank you.
My pleasure.
You know, it's funny, this has really brought us together in a way
I
that
think
we're really
this is-
funny.
I think we're supposed to make it feel like we're just casually strolling
Okay,
along.
all right.
You can record a few comments. Don't